Plus, a group of doctors are making medical history, completing for the first time ever in the U.S. a total face transplant. How does the procedure work and why some are raising ethical concerns about it? We're going to take you behind the scenes.
Jane?
It's been done before, but never in the United States. Now, the first ever face transplant has been performed at the Cleveland Clinic, but the risk for the patients aren't over. Could the patient suffer rejection of her new face? Behind an incredible medical feat. That is straight ahead, 2 minutes away. Well, it was, at least for one patient, truly miraculous surgery, a total facial transplant for the first time done in the U.S. The most extensive procedure of its kind ever performed here. But now that the surgery is over, there are some big risks that are just beginning. And to explain it to us, Dr. Gary Breslow is joining us. He's a plastic surgeon, and he has also done facial transplantation. Doctor, thank you for being with us.
Thank you for having me, Jamie.
How complicated is the surgery? How risky is the recovery?
First, I'd like to point out I haven't actually done facial transplant surgery. As a reconstructive microsurgeon, I've done several procedures that have dealt with the patients that Dr. Simonow's team has just dealt with in terms of severely disfigured patients. And I just want to actually point out that I think it's remarkable what they've accomplished, because anyone who's dealt with these patients will know the limitations of what can be done with conventional techniques. And, conventional techniques tend to focus on using your own body's tissues and trying to replace the tissues that are disfigured or deficient.
Is that what was done here? Because this patient had a tissue issue, basically.
Right.
And so now in 22 hours, they reconstructed her entire face.
Correct.
Does she have a good prognosis?
Well, there's a few issues. I think one of them was the surgical obstacles that Dr. Simonow has diligently and methodically dealt with. Through years of research, she really has done a remarkable job of taking tissue from another human being, a cadaver, and actually transplanted it. The advantage of this is that you're
Doctor, I'm so sorry. We've had so much breaking news with this incident in Denver and otherwise. People are asking and want to know, how do you think a patient like this does based on the reconstructive work you as a microsurgeon have done?
I think this is remarkable. I think that the ethical issues that they were concerned about in terms of whether, this is the right thing to do, I think that, if anyone could actually sit there and think about what it's like to go through life without a face, and then what Dr. Simonow has done to give them the opportunity to actually have a semblance of a normal life again, it's really remarkable, because the conventional reconstructive techniques have their limitations.
Are there a lot of drugs, though, involved? Is it a tough ride from here?
There are, and that is one of the things that that has to be dealt with, and you're subjecting yourself to lifelong immunosuppression. But there's been tremendous advances in that field as well.
So do you live in a bubble, or you can actually live a normal life?
No, they're able. I mean, they have to change their lifestyle. They have to commit to lifelong medications. But they can, infections are dealt with differently. But they do not live in a bubble. They live normal lives. Heart transplant patients, lung transplant, kidneys, they all live relatively normal lives.
Will we see more of these?
I think we will. I don't think it's going to be a little while. I think a lot of the details have to be worked out, but I think it's in specific cases like the one that was just done. I think under the right circumstances, I think it's remarkable. I think it'll be very useful.
And just so people understand, what are some of the causes of someone needing to have facial transplantation? Is it always a trauma or an injury, or could there be a disease that actually affects the tissue?
There can be a disease process. It's either trauma or burn. Patients very commonly have severely deforming faces. It really is a case-by-case basis, but it's really not what's causing it as much as what they're left with.
All right, Dr. Breslow, it's interesting to talk to someone who may not have done a total facial transplantation, but we know that it was the first time, and we would love to have you back if something like this is attempted again. Thank you for being with us.
Thank you for having me.
Kelly?